Centre.
Thank you, Mr. Speaker. Thanks for the chance to come back to a question I asked of the Prime Minister about a month or so ago. And I asked the question because it was on long-term care. Back in 2019, when I was knocking on doors in my community, I heard from neighbor after neighbor, both those that had a parent in care, for example, or those who were caregivers, sharing their concerns with the crisis they saw as a result of decades of underinvestment. Well, it's an example of where the pandemic really only made things worse, because if you fast forward to then 2021, we all know that the crisis in long-term care through the pandemic exploded. In my community, for example, I won't ever remember anytime soon, I've shared this story in this house before, I was speaking with a woman who was sharing about how her mom had been waiting in hospital for a bed in long-term care for 3 months. And as she told this story, I could see the tears streaming down her face. Or, when I spoke with a personal support worker who shared that, she was being honest, she said, Mike, I'm not giving 4 hours of care a day. I'm lucky if I am able to give 4 minutes of care a day. It's obvious that this crisis continues in long-term care, and we're not out of the woods yet. In fact, the most recent numbers I have available in the summer of 2021, the wait times for long-term care, it was still 52,000 people on the wait list. Now, last year, we heard in the Liberal platform and from the Prime Minister himself, billions of dollars being promised for long-term care. He shared the words, nothing is off the table when it comes to addressing the crisis in long-term care. But then if we fast forward to what we saw in the budget, I looked right through it, long-term care was only mentioned once. And when it was mentioned, it was only about funds that were previously allocated. There was also no mention of the Safe Long-Term Care Act, despite this being part of the agreement between the NDP and the Liberals, one of the few really key net new items. This is what prompted my question to the Prime Minister at the time and my continued concern when it comes to addressing the crisis. Now, to offer some ideas of what could be done, we can look no further than what the former member for Nanaimo Ladysmith, Paul Manley, had proposed in Motion 77. He put forward eliminating the wait times, paying long-term care staff adequately for their work and providing benefits and paid sick leave, implementing a basic care guarantee that would ensure that we have this minimum of 4 hours of regulated personal care per day for every resident. To take the profit out of long-term care and transition long-term care facilities to non-profit and cooperative management structures, and of course to introduce a Safe Long-Term Care Act modeled after the Canada Health Act to be sure that it establishes national standards for care and staffing. Now, in the Prime Minister's response, he shared that the government is working with provinces and territories. And so tonight, from the Parliamentary Secretary, I've got 3 questions I'd love to hear more about. First of all, does he and the governing party recognize that the crisis in long-term care continues? Secondly, when specifically will the governing party follow through on what they've already promised, tabling the Safe Long-Term Care Act? And finally, if he can provide an update, if work is being done with provinces and territories, what work exactly is that being done? Thank you.
The Honourable Parliamentary Secretary to the Minister of Health.
Thank you very much, Mr. Speaker, and I'd like to thank my friend and colleague from Kitchener Centre for his question, but also his work on this file and his dedication to seniors living in his riding and across the country. Many seniors have faced significant health, economic and social challenges due to COVID-19, which has really showed bare systematic challenges in Canada's long-term care system. As soon as COVID-19 exposed some of these challenges in our long-term care system, our government was there to help provinces and territories with additional PPE, with the armed forces and the long-term care facilities in Quebec and Ontario, and much more. Our government has also stressed the need for permanent long-term solutions for long-term care facilities where Canadians living and working in them are safe and treated with respect and dignity. Key to achieving that level of safety and comfort are national standards for long-term care. I would remind the member opposite that in March of 2021, the Standards Council of Canada, which is a federal crown corporation, the Health Standards Organization, and the Canadian Standards Association announced that they would be collaborating on the development of 2 new complementary federal long-term care standards. And that was a result of work from our government. Their collaboration with stakeholders across the country has focused on addressing the delivery of safe, reliable, and high-quality long-term care services, the design and operation of long-term care homes, and infection prevention and control practices in long-term care. For HSO standard, this means resident-centered care practices, which is a respectful, team-based environment, a healthy, competent, and resilient workforce with healthy working conditions and strong governance practices and operations. For the CSA group standard, this means cleaning and disinfecting processes, waste removal, HVAC, plumbing, medical gas systems, and the use of more modern technology in their care systems. We expect that the final release of those standards will be done at the end of this year. Budget 2021 also included a $3 billion investment to support provinces and territories in their efforts to apply these standards and ensure permanent changes are made. Mr. Speaker, the COVID-19 pandemic continues to highlight the challenges in long-term care, including gaps in infection and prevention and staffing. And Mr. Speaker, I believe that answers the first question that my colleague asked, which is whether or not we recognize this crisis is continuing. The answer is yes. Our government has made significant investments, including $4 billion, to help provinces and territories improve the standard of care in those facilities. In addition to that, $41.9 billion in cash support to provinces and territories through the Canada Health Transfer. Canadians can rest assured that we will keep working hard with provinces and territories so that we can fight COVID-19 together, and that includes in our long-term care facilities. On the campaign, we also committed to investing an additional $25 billion over 5 years to better support the healthcare system and provide better mental health services across the country for seniors. The provinces and territories would now receive over $47 billion through the Canadian Healthcare Transfer in 2021 and 2022, and territories $500 million to help them prepare for outbreaks of COVID-19. Mr. Speaker, to date, our government has spent more than 8 out of 10 of every dollar in this country to fight this pandemic. Mr. Speaker, there's a couple of other questions. When will the tabling of the Safe Long-Term Care Act commence? I believe work is underway, and we are working expeditiously on that because it is a priority for this government. I don't have any updates on work with the provinces, but I look forward to the next round of questions from my friend and colleague from Kitchener Centre. Thank you, Mr. Speaker.
The honourable member for Kitchener Centre.
Thank you, Mr. Speaker, and thank you to the Parliamentary Secretary, not just for his kind words, but for actually answering the questions that were offered this evening. I think both the respectful approach, but also a discourse that feels like exactly that, is what we should see more of in this place. And so I thank him for that. I understand he might not be able to share more about when the Safe Long-Term Care Act would be introduced. And so I wonder if with this final bit of time we've got available, if he could share more about any of his reflections on why there wasn't new funds allocated in the most recent budget, recognizing there is a crisis we are still in, and if there's more specificity he can offer for what would be in the Safe Long-Term Care Act and what all parliamentarians can do to advance it more quickly, recognizing that a crisis requires urgent action. Thank you.
The Honourable Parliamentary Secretary.
Thank you, Mr. Speaker. And while I know that it's challenging for Green members to appear at committee, I would invite him to the Health Committee at some point. Work is underway. We've been addressing human resources in healthcare, which is related to this challenge. But I would also highlight what I said in the previous round, which is that we are investing $3 billion through Budget 2021 to ensure standards for long-term care are applied and permanent changes made. Mr. Speaker, we all agree that living and working in long-term care deserves to be treated with respect and dignity in a safe environment. Our government has invested in immediate solutions while supporting efforts to permanently correct what needs correcting in the long-term care system, not only to better protect against a future pandemic, but to make every single day a day of safety and good living. Mr. Speaker, we owe it to our seniors in this country. They built this country. We are grateful for this country. It's a great place to live, and we owe them a life of dignity and respect, and that's what we are achieving together, collaborating in this place. Thank you, Mr. Speaker.